Trental tablets is a drug that improves microcirculation, an angioprotector as an xanthine derivative. Trental improves the rheological properties of blood, fluidity. Active ingredient pentoxifylline. Treatment with Trental leads to an improvement in the symptoms of cerebrovascular accidents. Indications: violations of the peripheral circulation of atherosclerotic origin, for example intermittent claudication, diabetic angiopathy, trophic disorders, for example like ulcers, gangrene, disorders of cerebral circulation, consequences of cerebral atherosclerosis such as impaired concentration, dizziness, memory impairment, ischemic and post-stroke conditions, circulatory disorders in the retina and choroid in the eye, autosclerosis, degenerative changes against the background of the pathology of the vessels of the inner ear and hearing loss. How to use. The dose is set individually in accordance with the characteristics of the patient. The drug is administered orally at 100 mg 1 tablet 3 times per day, followed by a gradual increase in the dose to 200 mg 2 to 3 times per day. The maximum single dose is 400 mg. The maximum daily dose is 1200 mg. Tablets should be swallowed well during or immediately after meal with plenty of water. In patients with impaired renal function, the dose should be reduced to 1 to 2 tablets per day. In patients with severe hepatic impairment, a dose reduction is necessary, taking into account the individual tolerability of the drug. In patients with low blood pressure, as well as in those at risk due to a possible decrease in blood pressure, patients with severe ischemic heart disease or with hemodynamically significant cerebral stenosis, treatment can be started in small doses. In these cases, the dose should be increased gradually. Contraindications: hypersensitivity to the components of the drug, massive bleeding, extensive retinal hemorrhages, hemorrhages in the brain, acute myocardial infarction, age up to 18 years, pregnancy and lactation, breastfeeding, hypersensitivity to other methylxanthines. Special instructions: pentoxifylline is able to enhance the effect of drugs that reduce blood pressure, ECA inhibitors, nitrates. Co-administration with other xanthines can lead to excessive nervous excitement. It is possible to increase the hypoglycemic effect of insulin or oral hypoglycemic agents when taking pentoxifylline. Increased risk of hypoglycemia. If combination therapy is necessary, strict monitoring of the patient's condition is required. In the elderly, dose reduction may be required. Side effects: from the side of the central nervous system, headache, dizziness, anxiety, sleep disturbances, convulsions, very rarely aseptic meningitis, flushing of the skin of the face and upper chest, swelling, increased brittleness of the nails. From the digestive system, xerostomia, anorexia, intestinal atony, feeling of pressure and fullness in the stomach, nausea, vomiting, diarrhea, in some cases intrahepatic cholestasis and increased activity of hepatic transaminases, alkaline phosphatase. From the side of the cardiovascular system, tachycardia, arrhythmia, cardialgia, progression of angina pectoris, lowering blood pressure. From the hepatopoietic system, leukopenia, thrombocytopenia, pancytopenia, bleeding from the vessels of the skin, mucous membranes, stomach, intestines, hypofibrinogenemia. On the part of the organ of vision, blurred vision, scotoma, allergic reactions, itching, skin hyperemia, urticaria, angioedema, anaphylactic shock. Side effects are possible when using Trental in high doses.